Been homeless for a little bit now. I lost my job and I lost my flat in the same time basically. And I got anxiety and depression from it all. Started drinking and that. Loads of pain like every day basically from a tooth. It's like pulsating from my whole body all the time, and it's just so painful. And I don't know why I never got it sorted. This has like changed my whole life now basically for me now. Like I'm so happy about it. It's so good. Yeah, I can't believe it.
The reason that we set these clinics up is that actually these patients have different lives. So they're struggling with many things. So even just thinking about where they're going to sleep at night might not, for you and me, we just walk in and go to our bedrooms, but these guys might be in temporary housing, they might have just come out of prison, so they need a little bit more hand holding. And so by providing these clinics, we're actually able to help them through the process. Many dental practices can seem quite daunting to somebody who's got mental health problems or hasn't been seen by a dentist or is really concerned by the way that their teeth actually look. So by taking the service to them, it really makes a massive difference to them.
These patients aren't turning to normal methods of pain relief to treat that pain. Unfortunately, if they're already drug dependent, they're treating their pain with upping their levels of their drugs that they're taking. So by relieving their pain, taking them out of their pain, then we can also help them from going to that higher level of drug dependency. So you're doing a massive job by helping them.
I'm here because I was homeless. I just need to move on, get my life back on track properly. Last time I saw them, I had a tooth out. So that was brilliant because that was catching, that was quite painful. And this time I can smile again. So yeah, this is invaluable really for me. I'm really happy because I've got rid of the hole that was in the front of my mouth.
Problems people attend with at these clinics are usually pain or broken teeth, because that seems to be what drives people really to seek care from a dentist. Clinically, we can do quite a wide range of things actually, from fixing teeth, taking teeth out as well, and general advice and carers on top of that. People also need to be treated with care and respect and a little bit of love really, because they come into these places, they're often very vulnerable, and they do need to be treated gently, just like we do with all our patients really.
Septodont supports Dentaid financially. We've provided the truck, we provide a lot of their materials, certainly everything that we produce, and we provide a home for them in the Maidstone area. It means a lot to Septodont to give something back. We want to work with our communities, we want to work with the dental profession. So all of the Dentaid professionals who volunteer their time are able to do that because of materials and equipment which has been donated through dental companies. And we're really proud that Septodont's been a big part of that here in the Kent area particularly.
Challenges that we face are that funding is always difficult, and some people don't understand why we put on these clinics, and unless they've experienced that clinic, they don't understand the difference that we're making with the type of dentistry we do. A lot of our dentistry is more about social issues, so it's more about breaking down those barriers rather than the actual dentistry they receive. And there's not many places that can provide that kind of treatment. So by using volunteers on our lorries, it really does make a difference. But funding is always a struggle. So the more funding we have, the more that we can do. Running these lorries isn't cheap. They're very technically difficult units to keep running. And they require a lot of personnel, so that's a really big challenge. And one of the main things is also volunteers, trying to find people who really want to give up their time. There is a lot of people out there who do really like giving up their time to provide dentistry to our patients, but we could always do with more.
The clinic means a lot, the help that it gives to other people and myself. It's taken a massive weight off my shoulders, like stress-wise and everything. Honestly, it's such a big help and I'm very grateful for it.
It's important to me personally to be able to give something back. I've had a good time in the dental profession, I absolutely love the work that I do, and I think it's really important that when we're in a privileged position that we are, that we can give something back to society as well. I think everybody should get involved with work like this, because it enables you to sort of widen your career. You get such a different range of people coming in. You have to constantly be thinking about not only the patient in front of you, but how you're going to manage the treatment that you're doing as well, in sometimes very difficult circumstances with people who are very challenging. So professionally it's fantastic for widening your career, but also it's so rewarding. It's something I absolutely love doing, and I get so much out of it. I think I get far more out of it than I put into it, really.
And I am so passionate about doing this job. The feeling you get from helping people with the skills that we have in dentistry are just amazing. You can't get that feeling from anything else I've done. I've been in dentistry for over 20 years and I've never done any job like this that I'm so passionate about. These guys are so grateful for everything that we give, and I get tearful just talking about it. I get tearful now. So if you can volunteer any of your time to just give a day or a few hours to help us, then we would be so grateful.